A patient's labs came in last week with a level of vitamin D of 175. That's a dangerous level. Um, why are so many people getting these huge levels? Because everybody's becoming very much aware, acutely aware of vitamin D and its role in everything from preventing depression to preventing diabetes to bone health and even arterial health. Now, so back in the late 19th century, early 20th century, we discovered rickets was a bigger problem. It was a lack of vitamin D, a vitamin D severe deficiency resulting in malformation of bones. Um, so what's going on now? Well, the pendulum has swung. We called the patient and made her aware of what was going on. It turned out, as we usually see, this was not caused by sun. It rarely is. I've never heard or seen vitamin D toxicity being caused by the sun or by foods. It's every time I've seen it, it has to do with injections. Again, because of the current popularity of vitamin D, folks, alternative care providers, functional medicine providers, a bunch of folks are giving injections of 25,000 units, 50,000 units, international units of vitamin D, and that's dangerous. Um, I have a little information on here. I don't have a complete literature review. I remember doing one in the past, and I also remember some comments even recently from one of our viewers saying, oh, well, levels of 125 are levels of 125 are fine. I get nervous when a level gets that high. Um, and I don't think anybody would argue with levels over 150. I've seen literature reports, science reports of toxicity, vitamin D toxicity at levels as low as 103. So again, I think you need to ask the question, do you really want to go to 125, start getting close to 150 and above? Or are you getting that much benefit once you start getting over 100? I made my own mistake once. You know how you fill those daily pill boxes, and you take if you take pills twice a day, then you use anyway. Without going into detail, I got mine up one time to a vitamin D level of 90. Stopped taking it for several weeks. Got back down to 60, and I think 60 to 80 are good levels. We could get into some argument about whether the right number is 20 to 40, which they used to say 20 years ago and was the standard, 60 to 80, which myself and a lot of other people are settling on right now, or if you really want to be a cowboy and get it 90, try to get it and keep it 90 to 125 to 150. Again, I don't think there's any significant scientific evidence indicating that you've got a whole lot of benefit above the 90 level, but you clearly have risk. What does vitamin D toxicity look like? Vitamin D is it's an interesting chemical. As you talk with docs and others, you'll find that it actually acts as a hormone. It impacts our body's absorption of calcium. Those of you, and there are many of us who are focused on the D3-K2 interaction. Many feel that D3 and K2 together helps get calcium out of arteries and into bones. Whether or not that's the case, again, the science is not so clear about that. But again, I wanted to do just a brief video, so I'll just go ahead and cover a few other things to get some warning out there about be careful when these providers want to give you injections of vitamin D. If you don't want to get into the science that much, and I understand completely, here's an article, and I will leave it. I'll leave a link to it under the video. It's very easy to understand, very layperson level friendly. The only thing I found that I don't agree with on it was their statements of sufficient levels, safe upper levels, safe upper limits. But again, I'll leave a link to that in the description below. Now, for those of you who are interested in getting geeky with us for a second, here's one of the here's some of the stuff out of the science that tells us a little bit about what's going on. These are the number of patients that were tested for vitamin D by year. 1996, it just wasn't happening. In 2000, people started testing. 2004, 2008, 2012, 2016, just continued to ratchet right on up, basically showing that there's a lot of increased interest in it. And where's my interest? My interest is more in terms of diabetes prevention, as well as mental health related issues. Some information came out recently indicating that having an inadequate or low vitamin D level results in, can increase your risk for diabetes. Here's I'll leave a link also to the Vitamin D Council. They've got, you name it, in terms of resources to know a little bit more about vitamin D. Couple of components in the literature. This one looks, I'll leave links to all of these. This one's, again, arguing on participating in the debate. Is it 90, 100, 125, or 150 where you really get into danger levels with vitamin D toxicity? As I mentioned, I've done several videos on vitamin D, and this one is one of them on vitamin D deficiency and linked to greater risk of diabetes. I've got several others on vitamin D and K2, and again, I'll leave some links for that. If you've made it this far, thank you very much for your interest. And please be careful if somebody wants to give you a vitamin D shot. And be very careful if they want to give you more than one.